Identifying the facial nerve during a parotidectomy is critical to avoid nerve damage and ensure the best surgical outcome. Here are key steps and landmarks surgeons use to locate and preserve the facial nerve. Anatomical landmarks. Tragal pointer. The cartilaginous projection near the ear canal serves as a reliable landmark. The main trunk of the facial nerve is typically 1 centimeters deep and slightly inferior to the tragal pointer. Tympanomastoid suture. This suture is found near the base of the skull and provides a landmark. The facial nerve is located just anterior to the suture. Posterior belly of the digastric muscle. The nerve lies just superior to the posterior belly of this muscle. Stylomastoid foramen. The nerve emerges from this foramen, which is located at the base of the skull between the styloid process and mastoid process. 2. Surgical techniques. Identify the main trunk. Start by locating the facial nerve trunk where it emerges from the stylomastoid foramen. This is done by carefully dissecting around the tragal pointer and the surrounding area. Retrograde dissection. If the trunk is difficult to locate initially, identify one of the terminal branches, e.g. the buccal or zygomatic branch, and trace it backward to the main trunk. Dissection in avascular planes. Maintain a clear surgical field and work in the loose areolar tissue around the parotid gland to minimize bleeding and improve visualization. Use of nerve monitoring. Intraoperative facial nerve monitoring can help confirm the identification of the nerve and provide real-time feedback to avoid accidental injury. 4. Visual cues. The facial nerve appears as a shiny, whitish structure. Gentle stimulation with a nerve stimulator can confirm its function. 5. Avoid common pitfalls. Do not confuse the nerve with vessels or connective tissue bands. Be cautious during dissection near scarred or inflamed tissues, as they may obscure the landmarks. By systematically using these techniques, the facial nerve can be identified and preserved effectively during parotidectomy.